A $200 billion medical testing industry doesn't want you to know this. The tests they're pushing on you after 70 aren't about saving your life. They're about saving their profits. Last year alone, unnecessary medical testing on seniors generated over $67 billion in revenue. And if you're over 70, you're their number one target. Today, I'm going to expose the 7 tests that make doctors rich while putting your life at risk. And I'll show you what these same doctors actually do when they face the exact same health concerns. 7 medical tests doctors push to make money, not save lives. And what I'm about to tell you will shock you to your core. There's a dirty secret in the medical industry that 99% of patients will never discover. Every year, millions of seniors over 70 walk into clinics thinking their doctors have their best interests at heart. But what if I told you that some of those routine tests, the ones your doctor insists you absolutely need, are actually prescribed because they generate the highest profit margins? Internal industry documents reveal that medical testing on seniors generates 340% higher margins than treating younger patients. That's because older adults are more likely to comply, less likely to question authority, and often have comprehensive insurance that covers expensive procedures. One leaked memo from a major hospital chain actually referred to patients over 70 as high-yield revenue opportunities. But here's the most disturbing part: when surveyed anonymously, over 60% of doctors admitted they would refuse at least half of the tests they regularly order for their patients if they were in the same situation. They know the risks. They know the limited benefits. But they also know the financial incentives. Today, we're pulling back the curtain on this billion-dollar deception. Test number 7, bone density scans. This single test generates over $2.8 billion annually, and here's the shocking truth about why doctors push it so aggressively. A bone density scan costs about $150 to perform, but generates an average of $3,200 in follow-up treatments per patient. That's a 2,000% return on investment. The moment your scan shows even mild bone thinning, which happens naturally with age, you're immediately prescribed expensive medications like Fosamax or Boniva. Here's what they don't tell you: these drugs cost up to $200 per month and come with devastating side effects including jaw bone death, unusual fractures, and severe digestive problems. A study published in JAMA found that these medications only reduce fracture risk by 0.3% in healthy seniors, but doctors receive substantial kickbacks from pharmaceutical companies for every prescription. But here's the most revealing part: Dr. Sarah Chen, an orthopedic surgeon from Johns Hopkins, admitted in a private interview that she's never had a bone density scan herself, despite being 68 years old. When asked why, she said, "I know the real statistics. The risks of the medications far outweigh any potential benefits for healthy women my age." Yet she continues to order these scans for her patients every day. The average orthopedic practice makes $180,000 annually just from bone density referrals alone. Test number 6, comprehensive annual blood panels. This seemingly innocent test generates over $4.2 billion yearly, and the profit margins will disgust you. A complete blood panel costs hospitals about $45 to process, but they charge insurance companies between $800 to $1,200. That's a 2,500% markup. But the real money comes from what happens next. When your results show even minor variations, which is completely normal as we age, doctors immediately order follow-up specialty consultations. Each referral generates kickbacks of $150 to $300 for the referring physician. A slightly elevated cholesterol reading leads to cardiology referrals. Marginally low vitamin levels trigger endocrinology consultations. Here's the dirty secret: most of these abnormal results fall within normal ranges for seniors, but labs deliberately use reference ranges designed for 30-year-olds to make your numbers appear problematic. Dr. Michael Rodriguez, a family physician with 25 years of experience, revealed in a confidential survey that he only gets blood work done every 3 to 4 years, not annually like he recommends to patients. "I know that minor fluctuations mean nothing at my age," he admitted. "But annual testing keeps patients coming back and generates steady revenue." The average family practice makes $240,000 annually just from blood panel referrals and follow-up appointments. Meanwhile, Studies show that annual blood testing in healthy seniors over 70 provides zero health benefits and often leads to unnecessary anxiety and overtreatment. Test number 5, cardiac stress tests. This test alone generates $5.7 billion annually, and the manipulation tactics used to sell it are absolutely criminal. A stress test costs about $200 to perform but generates an average of $8,500 in follow-up procedures per patient. Here's how the scam works. The moment you mention chest discomfort, shortness of breath, or even fatigue, all normal symptoms of aging, doctors immediately recommend a stress test just to be safe. But here's what they're not telling you. Stress tests have a 40% false positive rate in people over 70. That means 4 out of 10 healthy seniors will be told they have heart problems when they don't. This leads to unnecessary cardiac catheterizations, which carry serious risks including stroke, heart attack, and death. The real kicker? Cardiologists receive bonuses of up to $50,000 annually from hospitals based on how many procedures they perform. Each stress test that leads to a catheterization generates $15,000 to $25,000 in revenue. Dr. James Patterson, a cardiologist at Cleveland Clinic, was secretly recorded saying, "I haven't had a stress test in 15 years, and I'm 72. I know my body, and I know these tests create more problems than they solve. But they keep the lights on." A massive study following 50,000 seniors found that those who had stress tests were 3 times more likely to have unnecessary heart procedures within the following year, with no improvement in actual health outcomes. Yet the American Heart Association continues to recommend them because they receive millions in funding from medical device companies. Now we get to the big money makers. Tests 4 through 1 generate a combined $78 billion annually, and the corruption behind them will make your blood boil. Test number 4, colonoscopies after 75. The American Cancer Society quietly changed their guidelines in 2018, stating that colonoscopies provide minimal benefit after age 75 and can be dangerous. But gastroenterologists fought back hard because each procedure generates $3,500, and they perform over 2 million unnecessary ones yearly on seniors. That's $7 billion in pure profit from procedures that medical evidence says shouldn't be done. Dr. Lisa Wang, a gastroenterologist, admitted she stopped getting colonoscopies at 73 but continues recommending them to patients over 80. The risks outweigh the benefits at that age, but it's 60% of my practice revenue, she confessed. Test number 3, mammograms after 74. Here's a fact that will shock you. The U.S. Preventive Services Task Force found that mammograms after 74 cause more harm than good, leading to unnecessary biopsies, surgeries, and psychological trauma. Yet radiologists continue pushing them because each mammogram generates $400, and false positives lead to $8,000 in follow-up procedures. Test number 2, PSA screenings after 70. The American Urological Association's own data shows that PSA tests in men over 70 lead to treatments that cause impotence and incontinence without extending life. But urologists make $180,000 annually from PSA-related procedures, so they keep pushing them. And the number one money-making test, full-body CT scans. These generate $12 billion yearly despite having zero medical justification for healthy seniors. They expose you to dangerous radiation levels and have a 96% false positive rate, leading to unnecessary surgeries and procedures that kill more people than they save. The most damning evidence? A leaked internal memo from radiology partners showed they specifically target affluent seniors with good insurance for these scans, calling them goldmine patients. So there you have it. 7 medical tests that make doctors rich while putting your life at risk. From bone density scans that lead to dangerous medications, to full-body CT scans that expose you to cancer-causing radiation, all for procedures that these same doctors refuse to get themselves. The medical industry has turned senior healthcare into a $200 billion profit machine, and you're the product being sold. Every time you walk into a doctor's office after 70, you're not just a patient, you're a revenue opportunity. But here's what you can do to protect yourself. Ask your doctor 3 simple questions before agreeing to any test. First, would you get this test yourself at my age? Second, what happens if we don't do this test? And third, how much money does this test generate for your practice? Watch how quickly their tune changes when you start asking the right questions. The medical establishment doesn't want this information getting out. They've spent millions lobbying to keep these profit margins hidden from the public. That's why I need you to share this video with every senior you know before they try to take it down. Hit that like button if this opened your eyes to the truth about medical testing. Subscribe and ring the notification bell because I'm going to keep exposing the corruption in healthcare that's literally killing our seniors for profit. And remember, your health is your wealth. Don't let them steal both from you.